Hi, it's Dr. Z. In this video, I will review therapies. By the end of this video, you'll be able to explain key concepts about psychotherapy and describe several different approaches to therapy. Please feel free to pause the video at any time to take notes. What comes up for you when you hear the term psychotherapy? Psychotherapy is any approach that uses psychological rather than biological means to treat psychological disorders. We often shorten the term to therapy to make it less confusing and less scary sounding. The term counseling is also used to refer to therapy. There are a wide variety of therapies available based on the different perspectives of psychology. There are several key concepts to review first. Research has addressed factors that play an important role in the effectiveness of therapy. The therapeutic alliance is the relationship between the therapist and the client. This relationship is critical to successful therapy because it involves trust, respect, and cooperation on both sides of the relationship. When therapists do not assess the quality of a therapeutic alliance, research indicated that clients were 2 times more likely to drop out of therapy. The style of the therapist is also a contributing factor. Directive therapy describes a therapist that authoritatively directs the client toward a goal. In this case, the therapist is the expert and tells the client what they should do to address their issue. Dr. Leo Marvin from the movie What About Bob is an excellent example of a directive therapist who only uses his book, Baby Steps, to work with clients. Celebrity psychologist Dr. Phil is another example of directive therapy. Alternatively, non-directive therapy involves a therapist as a guide who walks along with the client by helping individuals gain insight into and acceptance of their own personal issues. Indeed, the client here is the expert about themselves and their personal experience. Therefore, the client will provide the direction. Dr. Carl Rogers is an example of a non-directive therapist. Now, let's discuss the different types of therapy available based on the perspectives of psychology. Think way back to Chapter 1 on the different perspectives of psychology. Psychodynamic refers to the unconscious and early childhood experiences. Therefore, when it comes to psychodynamic therapies, they assume that a person's psychological issues are rooted in the unconscious and early childhood trauma. We will discuss one specific type of psychodynamic therapy. The iconic therapist couch, where the client lays down facing away from the therapist, stems from the psychodynamic approach. Psychoanalysis is a form of therapy developed by Sigmund Freud. According to psychoanalysis, the source of the client's personal issue involves unconscious conflicts from early childhood. A therapist using psychoanalysis will aim to help the client bring to consciousness that personal issue and to resolve the conflict. Treatment will involve revealing these unconscious issues and exploring childhood trauma in order to heal. Psychoanalysts have 3 main techniques. Free association involves asking clients to say aloud whatever comes to mind, no matter what it is, in the hopes that it will allow for unconscious thoughts to surface. The therapist will then engage in interpretation of the client's thoughts to look for symbolic or hidden meanings in the client's words and actions. Dream analysis involves clients sharing their dreams, which are a source of unconscious content, and then the therapist continues with interpretation of those dreams. This photo from the movie 50-50 shows Adam seeking therapy as he copes with his cancer diagnosis. In this scene, the therapist, Catherine, appears to employ psychoanalysis. Again, I want you to think way back to Chapter 1 on the different perspectives of psychology. The humanistic perspective believes that people are innately good and are capable of choice. Therefore, humanistic therapies focus on an individual's ability to gain self-awareness and understanding about themselves to address their psychological issues. Both psychodynamic and humanistic therapies are considered insight therapies because they focus on self-awareness and insight into your own behavior. The most popular type of humanistic therapy is client-centered therapy, developed by Carl Rogers. The name Carl Rogers should sound familiar. He theorized that personality involved the ideal self and the real self. According to client-centered therapy, the source of the client's personal issue involves blocked progress towards self-actualization. The therapist's goal here is to guide the client towards self-awareness and self-acceptance. This self-acceptance is tied to the client's real self and ideal self being congruent. Client-centered therapists will use unconditional positive regard to provide a safe and non-judgmental place for growth. Therapists are also non-directive, engage in active listening, and reflect the client's speech back to them to help clients identify their thoughts and feelings. This photo from the movie Good Will Hunting depicts Will engaging in court-mandated therapy. In this scene, Dr. Sean appears to use a non-directive approach with Will.